brief, but it will be informative. So Matt, yes, what we're doing is Matt's going to man the computer, and we actually have a couple videos here. So cartoons, believe it or not. We're all set? All right, good afternoon. Let's try one more time here. Good afternoon. All right, now we're ready. All right, this morning, a lot of people spoke in generalities as to what's going on. This afternoon, you will get the unvarnished truth. Many members of Congress, some presidential candidates, and commissions are calling for the reduction, and in some cases, the total elimination of VA health care. A straw man proposal has been drafted, which calls for the total elimination of VA health care by 2035. To understand what is going on and how we got here, let's take a brief moment to review the history. In January 2003, 236,000 veterans were on a waiting list for 6 months or more. A 2003 presidential task force made 10 recommendations. They concluded that there was a mismatch between demand for access and available fundings. They made 10 recommendations, only 2 were ever implemented. From 2003 until 2014, DAV, other veterans groups, GAO, CBO, and VA's IG testified and/or submitted reports to Congress expressing concerns about access needs not being met. They were ignored by successive Congresses and administrations. 2014, waiting list scandal and access crisis was reported in the media. This began daily negative reports about VA, leading many in the public to believe VA is a bungling, inept organization which treats veterans badly. A recent independent assessment by the RAND Corporation finds current VA access crisis is a misalignment of demand and available resources. This is a direct echo of the 2003 Presidential Task Force assessment. Recent studies also show the problem is access, not quality of health care. Even VA's severest critics agree with this assessment. 2014, in reaction to the access issue, Congress hastily passed the Choice Act. 2015, implementation and problems with Choice Act were mainly due to short implementation timeframe. Background, VA already had outside care programs when Choice Act was enacted. Currently, VA outside care is complex with numerous programs: fee-based, contract care, PC3, ARCH, Choice, and 2 others. On November 1st, VA presented a consolidation plan for outside care to Congress as mandated by the Choice Act. In October 2015, an independent assessment mandated by the Choice Act produced the MITRE report, a 4,000-page document making recommendations on VA health care to Congress. The report shows VA outperforms the private healthcare sector in nearly every national medical metric. The only two it did not, it was equal. Commission on Care, also mandated by the Choice Center, is currently meeting in Washington to hear testimony, assess the MITRE report, and to make recommendations on the future of VA healthcare. The commission is comprised of 15 members, 5 appointed by the House, 5 by the Senate, 5 by the administration. Dave Gorman, a friend of Dick Mops and former executive director of DAV Washington headquarters, was nominated by the administration. No veterans groups like the American Legion, VFW, or DAV are represented. Many members are from private healthcare sector with no knowledge of treating veterans. A fear is they are not seeing veterans, but are seeing dollar signs. Originally, veterans groups were being marginalized by the committee and told their testimony wasn't needed, but you could submit a letter. In November 2015, DAV submitted a letter expressing our views. After protests, Gary Augustine at DAV and our independent budget partners were allowed to make a presentation to commission members in December. The commission was given 180 days to hear testimony, assess the MITRE report, and make recommendations. The first 90 was to hear testimony and assess. The next 90, the commission was to formulate permanent recommendations for VA healthcare for the next 20 years. As a comparison, commissions are normally given 18 months, not 180 days, to perform their duties. We feel 180 days is a rush to judgment. The recommendations were originally scheduled to be released in February, but again, after protests, it was delayed until June 30th. We were very, very concerned. Our concerns were justified. During the last week of March, a breakaway group of commission members drafted a straw man document calling for the total elimination of VA healthcare no later than 2035. Clandestine meetings by the breakaway group were held with congressional leaders. There are 7 members in the group. It will only take 1 more member to join them for the straw man document to become the Commission on Care's recommendation. The situation is extremely fluid. On March 31st, 8 major veterans groups sent a letter to the Commission on Care expressing grave concerns with the straw man proposal. The groups are DAV, VFW, the American Legion, Paralyzed Veterans of America, Military Order of the Purple Hearts, AMVETS, Vietnam Veterans of America, and Iraq and Afghanistan Veterans of America. To exacerbate the situation, some private health care providers can't wait. They have launched multi-million-dollar ad campaigns seeking to entice veterans to use their medical facilities, not VA. Ascension Health is one. There are no guarantees veterans will receive quality health care which fits their needs, obtain timely access to quality health care, but be properly billed. Due to the serious pushback from veterans groups and some Beltway media, on April 18th, 4 veterans groups were re-invited to testify before the commission. They were DAV, VFW, the American Legion, and Paralyzed Veterans. To supplement the testimony, DAV placed an online veteran survey seeking input from its members and veterans in general. The idea was for our executive director, Gary Augustine, to walk into the meeting with thousands of completed surveys. Within a few days, over 4,000 surveys were completed, with 82% having a positive view of VA healthcare and did not want it privatized. Make no mistake, the VA privatization forces are coordinated and well-funded. They use sophisticated techniques and poll-tested talking points to great effect. Terms being used by the anti-VA forces to reduce or eliminate VA healthcare are: 1, reducing VA to circles of excellence; 2, treating only combat or service-related injuries; 3, turning VA into an insurance program; 4, giving veterans plastic cards or vouchers to go buy health care; 5, privatize VA health care. To further exacerbate the situation, on April 28th, Senator John McCain introduced Care Veterans Deserve Act of 2016, or more accurately, let's give veterans a plastic card to go buy health care anywhere they want, at any time they want. Some provisions of the bill are laudable, such as longer clinical hours, longer weekend pharmacy hours, elimination or reduction of out-of-pocket expenses. On May 24th, DAV testified before the Senate VA committee. We stated Section 2 of the bill only addresses demand by expanding it into the private sector without providing any funding for the expansion. For this reason, DAV is unable to offer our support for this bill. On May 26th, Senator John McCain, attacked VA, DAV, and the American Legion as being against the choice program and being in bed with VA. On June 1st, VFW, DAV, and the American Legion responded to Senator McCain's assertions. We stated, we are not against non-VA care. In fact, we have offered our own plan. Simply put, veteran-centric, holistic VA coordinated care. According to the Office of Budget Management, to give every veteran a choice card to purchase unlimited health care in the private sector without management would cost hundreds of billions of dollars, basically bankrupting VA. Proposals such as Senator McCain's are unsustainable and will ultimately shift the financial cost onto every veteran. All right, how has DAV responded? We need your support. So this brings us to DAV's new grassroots initiative, the Benefits Protection Team. Matt, you're up. And the sign guy took the equipment home.
Paul sees more value in meeting with elected
Matt,
officials.
can you rewind it back so we can get the volume up?
Impact veterans. This is Pete.
Hey guys.
And this is Paul.
Hi everybody.
And both are veterans. Pete here doesn't belong to any veteran service organization. Paul is a member of DAV. Pete's idea of veterans advocacy is complaining about veterans issues on social media. Paul sees more value in meeting with elected officials to discuss proposed legislation that will positively impact veterans. Pete gets his information from questionable sources. Paul reviews the toolkit on DAV's new grassroots website to improve the effectiveness of his advocacy efforts. Paul is a member of DAV's Benefits Protection Team. Pete, well, we're not really sure what Pete does. Don't be a Pete, be a Paul. Go to dav.org/grassroots to find out how you can become a member of DAV's Benefits Protection Team. After all, preserving our benefits begins with you.
All right, we're asking you, if you've signed up already, thank you. We really appreciate it, it's very important. If you haven't, I'll give you instructions how you can do it. First of all, don't be a Pete who gets his information from dubious sources. Be a Paul who gets his information from reputable sources such as DAV. As a group, we are very good at contacting Congress, but because of the seriousness of this situation, we want to double our contacts. We're asking every DAV member and the public to join the Benefits Protection Team. The first step is, and you get a handout in your registration book, so you can look at some of this, and there's also 2 flyers on the DAV table out there. First step, we're asking every DAV member and the public to join the Benefits Protection Team. First step is go to the Commander Action Network, and that is dav.org/CAN, C-A-N. All you gotta do is follow the directions, type in your information with zip code. You will receive on the internet action alerts. They'll compose letters to your representative and or senators. They can be modified. Fill in the subject line and click send. It's that easy. Also, to emphasize the seriousness, we are rebranding the role of legislative chairs or legislative directors. Instead of department and chapter, we'll now have a Benefits Protection Team leader. The new department and chapter officer reports reflect the change. To learn more about the Benefits Protection Team, go to dav.org/grassroots, all one word. It will contain information and links to a toolkit that will help you in contacting your legislators, how to do it, meetings, thank you letters, etc. A key component of the Benefits Protection Team is setting the record straight. That page can be found on dav.org/setting the record straight, all one word. That's not in the handout in the registration bag, but it is. There's a flyer on it on the DAV table. This page contains videos which address the fallacies of the following issues. 1, reducing VA to circles of excellence. 2, treating only combative service-related injuries. 3, turning VA into an insurance program. And 4, giving veterans plastic card or vouchers to buy health care. And 5, privatizing VA health care. Matt?
When it comes to veterans' health care reform, it's hard to separate the noise from the truth. So DAV is setting the record straight. Some candidates, political groups, and commissions are talking about privatizing veterans' health care and eliminating the VA.
VA facilities that are underutilized will be dispensed with, and a bracket process will begin to close the other facilities. All enrolled veterans should now be given the option of community care, and a deliberate plan should be developed to transition the others to community care over the next 2 decades.
So why is this such a bad idea, and how could it possibly hurt veterans? If VA were privatized and eliminated, management of the veterans' health care system would shift to an unaccountable, independent entity driven not by the needs of veterans, but rather by corporate financial considerations and bottom lines. As a As an example, the amount of time that private doctors would spend with veteran patients would likely dwindle, as is the case in the private sector today, where economic pressures have driven down medical appointments to 15 minutes or less. Additionally, in order to control costs, millions of veterans would have to pay higher out-of-pocket co-payments and deductibles in the private sector. And instead of having the choice to get all their care from one integrated healthcare system, VA hospitals would be closed, and veterans forced to navigate a private sector market on their own, while an independent board decided which veterans are eligible for care, how much, and what kind of care they get. That's why several polls have shown that veterans don't want to privatize VA. A bipartisan survey conducted in 2015 found that 80% of veterans strongly oppose privatization, regardless of their political affiliation, branch of service, or geography. So what's a better solution? We must transfer more of VA's non-medical support services like construction, maintenance, and IT development to the private sector, allowing VA to focus on its core mission of providing high-quality, accessible medical care. By integrating community care into an improved VA system, instead of eliminating VA, veterans will have more access points closer to home, providing holistic and coordinated care, the benchmark of quality care. Don't get lost in the noise. Learn more and get involved in the effort to reform veterans health care at dav.org/setting the record straight.
Okay, it's time to bring this on home here. DAV goes up to Capitol Hill and, in my humble opinion, makes terrific presentations to legislators and their staff. But if the phone isn't ringing with calls supporting our efforts, it goes for naught. Legislators have told us directly, if this issue is so important, why isn't my phone ringing? We need to make it ring. Basically, we are only as effective as our members and the public make us. We need your help. The situation regarding the future of veterans' health care is extremely serious. Remember, we are the power, not them. With your help and effort, these obscene proposals will be defeated. Thank you for your time and attention.
And on behalf of the membership, I look forward to Al Labelle continuing on as our legislative director, one of the best in the nation.